Welcome again. Let's talk about painful erection and all you need to know about painful erection. So straight, painful erection, though often a sensitive and rarely discussed topic, can significantly impact a man's physical and emotional well-being. So understanding the causes and of course the available treatment option for painful erection is very crucial for anyone who may be experiencing this issue, of course, as well as for their partners. Because if my partner has issues, I'm having issues when it comes to sex. You understand? From physical conditions to psychological conditions or factors, let's explore the diverse reasons behind painful erection and, of course, discuss the treatment option available. So, by breaking the silence surrounding the issue, we hope to provide you valuable information that can lead you to make informed choice and, of course, improve your sexual health and enhance the overall quality of life. So let's go as we dive into the essential insight you need to know about painful erection and, of course, how to address them. I'm your friend. You're welcome again. Understand the painful erection. Painful erection is also known as priapism. And when we're talking about priapism, it's a persistent and often painful condition in which the penis remains erect for an extended period of time without sexual arousal or stimulation. It just happens. Unlike a typical erection that occurs in response to sexual desire or stimulation, and of course, immediately you ejaculate, it subsides. Or when the cessation of arousal stops, when there is cessation of arousal, it stops. Priapism is not usually associated with sexual activity, and most of the time it is not easy to resolve it. And of course, this priapism or painful erection can be so distressing and uncomfortable. This one can last for several hours or more if a definitive care is not seen. What are some of the causes? Number one, painful erection or priapism may have various causes which may be broadly categorized into physical, psychological, and medical factors. So here are some common causes of painful erection. We have the physical causes, and when we're talking about physical causes, there's something we call Peyronie's disease, and this is just a condition that happens to the penis. It's characterized by the formation of fibrous plaque in the penis, in the penile tissue. What does it do? It leads to curvature, and in some cases, it can lead, because of that curvature, there will be painful penile erection. And at times it can be penile fracture. Some don't know that the penis has bone when it is erected. So a traumatic injury to the penis can often caused by rigorous sexual activity can result in a penile fracture with associated pain. And when we're talking about priapism itself is a painful erection, and it can be triggered by various factors, which include blood disorders, some medication, some drug use, and if of two types, we have the ischemic. Ischemic is associated with impaired blood flow out of the penis when there is a problem with blood flow. And non-ischemic priapism occurs due to an increased increased flow of arterial blood into the penis. Then the first one is out. And priapism is also characterized by an abnormal and prolonged engorgement of blood, you understand, within the penis. Thereby, it results in rigidity, persistent comfort, pain. So it is very, very important to seek prompt medical attention because it is an emergency. Now, I want you to know we have the psychological factor like stress, anxiety, and when we're talking about psychological stress, can lead to sexual dysfunction, and this including painful erection, which affect blood flow and leading to relaxation of penile tissues. And of course, can be relationship issue, conflict or problem within the relationship, and of course contribute to performance anxiety, and consequently what happens? There will be painful erection, what we call priapism. Then we have the medical condition. or infection. Certain infections such as penile infection or sexually transmitted infection, STIs, can lead to pain during erection. It is one of the causes. Then we have inflammation. When we're talking about inflammation, inflammatory condition affecting the penis or genital area can cause discomfort during erection. Then apart from that, another thing that can lead to that is hormonal imbalance. When we're talking about hormonal imbalances, particularly is related to testosterone, that's the male sex hormone, which can influence sexual function and potentially lead to painful erection. Then we have some medications such as anticoagulants, some medications, antipsychotics that they use to treat erectile dysfunction. You understand? May have priapism, that is painful erection, as a side effect. So it is worthy to note that priapism is a painful, prolonged erection. And is one of the specific type of painful erection. Not all painful erection are priapism though, but the underlying cause of the pain should be identified and be treated accordingly. So let's go straight to the symptoms of painful erection. Though as the name indicates, pain is the main feature of this condition, though it may exhibit certain other signs and characteristics. So some of the symptoms we want to talk about, number one is persistent erection. That is it. Then the most obvious sign is an enduring and painful erection that lasts for an extended period of time. Typically, it can be more than 4 hours without sexual arousal, without stimulation, without feelings and romance and all that. Tenderness, the affected area of the penis may feel tender to touch. At times, there will be swelling because there is inflammation, prolonged erection, swelling. The penis may become swollen, firm, and engulfed due to the prolonged blood flow. At times, because of the tension and all that, there might be discoloration. In some cases, the penis may become discolored. You understand? Because it's a serious emergency. Typically appearing dark or purplish blue due to prolonged engorgement. So it is important to note these symptoms and seek medical attention immediately. It will help in identifying the underlying causes and, of course, initiate the appropriate treatment to alleviate pain and prevent further potential complication. Other causes that we have is inflammation of the penis. We have urinary tract infection, penile cancer, phimosis, inflammation of the prostate gland, bladder stone, infection, reactive arthritis, urethritis, blood clot disorder, hard flaccid syndrome, insect bite, then the use of recreational drug. In the next video, we'll be talking about how to manage priapism, that is painful erection. See you in the next video.